Welcome to The Explainer. Today we're diving into a truly fascinating medical evolution, one that literally touches the lives of millions of women across the globe. We're looking at the caesarean section. It's a life-saving procedure with an incredibly rich history and honestly a surprisingly recent transformation. If you've ever wondered how modern surgical techniques actually evolve, how they really improve over time, you are definitely in the right place. We're going to compare the traditional approach with a groundbreaking innovation known as the Pelosi method. Let's just establish the sheer scale of this procedure right off the bat. A staggering 32% of all U.S. births are C-sections. Think about that for a second. Nearly 1 in every 3 babies born in the U.S. arrives via this surgical route. It's not some rare niche thing. It is absolutely a cornerstone of modern obstetrics.
And when you convert that percentage into hard numbers, it translates to about 1.3 million cases annually. Because it happens so often, we kind of forget how serious it actually is. This is literally the most common open major surgery performed in the United States today, period. So with that massive scale in mind, the way this surgery is performed matters immensely. Even a tiny incremental improvement in the technique can positively impact over 1 million patients a year in the U.S. alone.
So here's our surgical roadmap for this explainer. We've just covered the sheer scale of C-sections, and next, we'll hit the century-old standard, the Pelosi simplified method, the Mobius retractor innovation, delivery and closure, and we'll wrap up with the benefits and limitations.
All right, part 2, the century-old standard.
Now, let's start with the traditional approach. Introduced way back at the turn of the 20th century, the Pfannenstiel incision became the gold standard because it offered better exposure and lower hernia risks compared to those older vertical cuts. But here's the catch. This method relies heavily on extensive tissue dissection, and over the decades, its precise steps became highly standardized. But surprisingly, that standardization happened largely due to institutional traditions and just the personal preferences of surgeons, rather than rigorous, evolving scientific evidence.
So what does this actually look like? Well, the conventional method involves extensive, sharp, and blunt dissection of the rectus fascia. The mobilization of this sheath extends pretty much all the way to the umbilicus, or the belly button. The underlying muscles are physically separated, and the peritoneum is opened up using sharp dissection. Anatomically speaking, this represents a major disruption to the abdominal wall. And sources point out a really crucial issue here. All that extensive dissecting in the traditional method can actually traumatize blood vessels and risk severely damaging the nerves that enter from the underlying muscles. And to make matters worse, this is often compounded by the use of harsh metal retractors holding the incision open, which can press right down on those exact same nerves. In stark contrast, the Pelosi method was specifically designed to be minimally invasive. The whole goal was to avoid that extensive, unnecessary tissue trauma altogether.
Which brings us to part 3, the Pelosi simplified method.
Fast forward to the early 1990s, medical researchers started using cadaveric dissections to test out a brand new approach. And what they found was a real game changer. A massive incision simply wasn't always necessary. Instead, a minimally dissected, transverse lower abdominal incision positioned directly over the lower uterine segment is completely sufficient. It gives the surgeon a much smaller, cleaner access point that completely sidesteps the massive tissue disruption of the older method.
Moving right along to part 4, the Mobius retractor innovation. Okay, so creating a smaller incision is great, but it introduces a totally new challenge, right? How does the surgeon clearly see what they're actually doing in there? Well, to achieve clean surgical exposure without those dangerous metal tools, surgeons turn to a brilliant little innovation, a flexible, elastic device. The operator performs what's affectionately called a Mobius flip in a few really simple steps. First, they hold the outer ring at the 11 and 1 o'clock positions. Then, with a twisting motion, they roll the ring down outwards, slide their fingers down to complete the flip, and then just repeat that whole process until it's nice and snug against the patient's skin. It smoothly adapts itself perfectly to the specific depth of the wound.
Once it's in place, this elastic ring evenly compresses the skin and the peritoneum. And this is the magic part. It totally eliminates the need for the heavy, tissue-damaging metal blades of the old Belfour retractors. There is no hard metal resting against the psoas muscles. There's no entrapping the femoral nerves. It just provides beautiful, clean, open surgical exposure.
The data on this is actually pretty incredible. When you compare the two methods using the exact same 14-centimeter incision length, the difference is night and day. The conventional 4-point metal retractor yields an exposure area of about 98 square centimeters. But the Mobius elastic retractor, because it stretches the tissue safely in a full circle, it provides a massively improved 154 square centimeters of working area. That is way better intra-abdominal visualization for the surgeon without having to make a larger cut on the patient. It's a total win-win.
All right, part 5, delivery and closure.
With that superior visualization secured, the actual delivery of the baby becomes highly efficient. Following delivery, the surgeon performs an incredibly easy in situ closure of the hysterotomy, which is just the incision in the uterus, because the tissue is so easily accessible. Finally, the skin is closed up with a neat, continuous suture, or sometimes staples. And here's the best part. Sources show that this minimal initial dissection ultimately leads to a much faster, easier recovery process for the patient.
And part 6, benefits and limitations.
To maintain a fully objective perspective here, we definitely need to look at both the global adoption of this tool and its practical limitations, because every medical advancement operates in the real world. While the Mobius retractor is usually placed incredibly fast, like under 40 seconds, it isn't a perfect fit for absolutely every scenario. For instance, if a patient has severe pelvic adhesions from previous surgeries, that might preclude the safe and effective placement of this elastic retractor. On top of that, during highly urgent life-or-death crises, the conventional method is often still necessary if the operating surgeon happens to lack specific experience with the Pelosi technique.
And that brings us to a really fascinating core tension at the heart of medical advancement. As we wrap up this explainer, I want to leave you to ponder this provocative question. Why do standardized surgical techniques so often rely on institutional traditions rather than evolving scientific evidence? The whole comparison between the established Van and Steel method and the newer Pelosi technique really highlights how medical standards are evaluated and adopted in the real world. I mean, how fast should our medical institutions transition to new techniques when better evidence is presented? It's a lot to think about. Thank you so much for joining me for this explainer, and as always, keep questioning the standards.